Okay, so welcome again, everybody, to the Care First daily webinar on vulnerable groups and how to support them, how to stay safe. My name is Jack Walsh. I am Service Manager at Care First, and I'll be running through the session today. Obviously, if you're watching this back, Q&A function won't be available at the end of the session, but please feel free to pop any questions or queries you've got if you are watching this session live. And obviously, any follow-up queries you have after the session, you can get in touch with the service. So we'll get started. Okay, so obviously the session we wanted to sort of talk about today was just to kind of collate some information and look at kind of vulnerable groups and who might be in a vulnerable group, how we can support them, what the government advice is, etc., things like that, because there's lots of information floating around and lots of changes at the moment with those vulnerable groups and shielding and things like that. And the reason we wanted to put on the session really was something that's been popping up a lot recently is this simple question of surely isn't everybody at the same risk of COVID-19? And whilst everybody is of COVID-19, hence why we're following social distancing guidelines, and there are enhanced restrictions, you could say, for certain groups, which we'll look at in a second. There are obviously people who are more prone to it than others, and we're going to explore who those people are and what that looks like as we move through the session. So having a look at the kind of the research and the things out there on the World Health Organization, the public health body, NHS website, government website, etc., stuff like that. There's clear evidence and lots of reports which are daily, more information being found out and more research is being done to suggest that COVID-19 or the coronavirus doesn't affect all population groups equally, and there's lots of different factors. I'll let you have a little read through these yourself, but as we'll see as we move through the slides, age and men are more likely to be susceptible to COVID-19, as well as different ethnic groups. So the BAME community, perhaps hygiene quality can impact it, as well as your geographical area. Obviously, large built-up areas can sometimes be more prone to transition and risk of COVID-19, because obviously there's interchanging kind of people, objects, things like that. So lots of different factors that can impact the the risk or the high risk of contracting COVID-19. But if we look at the vulnerable groups in particular, the NHS England, if you go onto the website, the latest information categorises vulnerable groups into two separate categories. So one is high risk, which is extremely clinically vulnerable, and the other group is moderate risk, and that's clinically vulnerable. And we'll just look through briefly who the high-risk individuals are and who the moderate risk are. So it might be yourself, or it might be a friend or family or people in your life that you're kind of thinking about or concerned about, etc. Like that. So I'll let you have a little read through of some of these here, but obviously the ones that jump out really are people who have had organ transplants, perhaps are going through cancer treatment. That could be chemotherapy, antibody treatment, it could be radiotherapy. If you have a severe lung condition, obviously COVID-19 is a respiratory virus, so it can obviously impact the respiratory system, lungs in particular. Anybody who's taking medicine which might make infections more likely, or might impact the immune system to tackle infections, and anybody who's pregnant who has a serious heart condition, so they fall into the high risk group. And if we look at the moderate risk, some of these are kind of a little bit of a smaller group of people, a lesser group than the high risk one. So for example, at the bottom, generally if you are pregnant without a medical condition, then you fall into the moderate risk group. People with diabetes, people with heart disease over the age of 70 is in the moderate risk group, as well as, again, medicines that can impact your immune system, etc. So that's kind of a little bit around who the moderate risk group is and who the high risk group is. But what we want to remember is that these lists may well include more people and more conditions who are vulnerable that we don't yet know about, because the virus is still so new and we're still learning so much about it, and the professional health organizations are conducting research daily. We're finding out more and more about the virus and who it impacts more than others. So this research is being done, and these lists are being updated regularly. So our recommendation is always to kind of keep tabs and check up on the list, just in case a vulnerable group hasn't been mentioned that is vulnerable. And there may well be some groups that we haven't mentioned on the session today. So just to kind of make the point that those lists aren't necessarily all the vulnerable people at the moment. Obviously, we're limited for space on the slide deck, so we've just kind of highlighted some of the key ones there, but there may well be more. So yeah, just to kind of be mindful of that. And another question that's come up quite a lot recently is there increased risks for the BAME community, so the Black and mixed ethnicity? Is there an increased risk if you're white? So whilst age and being male are currently the kind of main factors in increased risk of COVID-19, its impact is disproportionate for other Asian, Caribbean, and Black communities. You may be familiar with the reports that people are eagerly awaiting through the government and the public health organisations on the COVID-19 impact for Black and mixed groups. It's not yet published, and that report is eagerly anticipated by various people within the groups, but also the various scientists and medical professionals around the country and around the world, really, to really understand why the impact of COVID-19 is disproportionate. But unfortunately, we're not aware and we're not yet seeing that report, so hopefully it comes very soon. But research and opinions in the medical professionals are that the risk of COVID-19 is disproportionate to the BAME community. So there is obviously an increased risk there as well. So if we or someone we know is in one of the vulnerable groups, what steps can we take to safeguard against infection? So we're going to look at some of the tips in a second, but we just wanted to kind of refresh memory or maybe update you on the latest government advice, which is taken from the government advice in England. So mindful that the dates and some of the suggested advice may differ for Wales, Scotland, Northern Ireland, Ireland, etc. So be mindful that these dates might not necessarily correlate with your geographical area. So we definitely would encourage you to kind of check what we've said today and make sure it's in line with wherever you're based. You might be just on the border of England and Scotland, or have family in Scotland but you live in England, that sort of thing. So we just want to be mindful of the people and the groups of where they live. So I'll give you a moment to have a little read through these yourself, but obviously from the 6th of July, so from, I believe, Monday just gone, this week, if you are a vulnerable person or within a vulnerable group, you may, if you wish, meet in a group of up to 6 people outdoors, including people from different households, but obviously key to maintain strict social distancing. And you no longer need to observe social distancing with other members of your household. So obviously really good for people now kind of, hug and shake hands and spend some time a little bit closer to people. Because although we might be in the same household as others, it's always difficult when we can't just kind of, maybe have that reassuring arm around the shoulder or console kind of, family members, etc., stuff like that. So definitely a welcome update from the government there. And looking forward to August, again, the government advice or the NHS advice in England is around returning to work if you cannot work from home. Obviously, as long as your business is COVID safe and is following the various different procedures and protocols to make sure the working environment is clean and safe and risk-free. Obviously, children who are clinically vulnerable can return to their education setting. So obviously, we're going to be looking forward to September, I believe, there when the schools kick off again. Again, depending on geographical location and area, just to check that. And obviously, vulnerable groups were encouraged to shield and stay home as much as possible beforehand. So obviously, from August, we can go outside, buy food, go to places of worship, stuff like that, but still maintaining that social distancing. That is the real key message in whatever we're doing. So obviously, remaining cautious if we're at risk and things like that. So that's kind of the latest NHS and government updates as far as updating yesterday, the 7th of July. So again, depending on when you're watching this session or after today's session, always good to just double check and see what additions have been made or what changes or updates have been added on, just to kind of fact check ourselves and not just take what we say as gospel. Please feel free to kind of check it and make sure you're happy and satisfied with the advice that you're hearing today. So if we're in a vulnerable group, just to kind of recap a couple of things and a couple of the key suggestions in whatever we do this month or from August onwards, we are still encouraged to try and stay at home as much as possible, work from home if we can, and obviously only going into the workplace and returning to work if it's safe to do so, in line with kind of COVID-19 kind of advice on social distancing, kind of clean, risk-free workplaces. Still be mindful to try and limit contact with other people. And if we are out and about and we are meeting people, maintaining that social distancing, that's really key to reduce that transmission and obviously reduce the risk of how that might impact us if we do contract coronavirus as a vulnerable individual. You might choose to wear PPE in not necessarily a kind of instruction from the government or ourselves, but just a recommendation. Sometimes kind of gloves or a mask wherever we're kind of going out and about. Just that added extra bit of kind of safety, better safe than sorry sort of thing. And still washing our hands on a regular basis. So when we're going out, washing our hands before and after we come back. People are coming around to our house, encouraging them to wash their hands before they come in and midway through and stuff like that. And just generally kind of cleanliness and disinfecting, places if we have had visitors in our home or around our home. That those sorts of common sense approaches are going to be really useful to reduce that risk once we start to maybe get back to some level of normality. And if we're supporting others, again, some of the advice is very similar. So it might be, again, you choose to wear PPE when you go around and visit people. I know I definitely do when I go and see my granddad, kind of mask up and glove up, and usually kind of just sit outside the doorway, just so we've kind of got a good distance between us and reduce the risk as much as possible. Washing hands wherever we go. Supporting vulnerable groups. So again, whilst we can, or from August, we can go out and do our shopping and go to places of worship, etc. Better safe than sorry. Can we still continue to support vulnerable people or vulnerable groups in our life by helping them with shopping or things like that, and bringing medicines and supplies around for them rather than them going out? So that might be something we can do. And staying connected is really, really useful and really, really key for everybody, but in particular those vulnerable groups, especially as we start to come out of the the shielding and the restrictions start to lift. So that staying connected might be, we now can kind of pop round or meet up outside and have a social interaction with people in our lives, up to 6 people. It might be that we connect in other ways. So we might, we might do video calls, we might do quizzes, we might, just keep in touch with kind of, text messaging and writing a letter or having a chat with vulnerable people in our community, not necessarily people within our friend group or our family group. So, those people who, although we can go out and we can start to do some more normal things as of kind of, July and more in August. We might have vulnerable people in our community or in our lives who are very, very far away from other loved ones who perhaps a little bit difficult to kind of travel, etc. So just be mindful and maybe connecting and helping people within our community and within our friend groups as well would be really useful. And that human connection is really, really good for building that kind of positive mental well-being and giving us that kind of happy, feel good feeling when we speak to people, when we interact, when we have conversations. So really, really useful. And again, simple little things, nothing too kind of Care First, obviously an employee assistance program, and you likely, if you're listening into this video, have access to the service. If not, there are lots of different support services out there. You might want to check with your organisation if you have access to it, or you might want to tap into the NHS or Samaritans. If you have access to the Care First service, we are a 24/7 counselling and information provider. So we've got UK-based BACP accredited counsellors operating our counselling support line all day, every day. So you can give us a call at any time, get some support and information in the moment. It might be to support with your emotional well-being or your mental health, or it might be to ask some queries and questions around, support for vulnerable groups or how you can encourage and promote positive mental well-being in those vulnerable groups if they're finding things a little bit difficult, a little bit tricky. Haven't got the contact information on this slide purely because there are lots of different routes into the service. So we have lots of different phone numbers and access routes. So if you do want to get in touch with the service, our recommendation would be to get in touch with your manager or team leader or your HR team, or have a little look on your intranet, and you should be able to get hold of our leaflets, our posters, and our free phone telephone numbers so that you can get in touch with the service if you want. That's everything from me. Hopefully some useful, informative information on today's brief session. And any questions you have, I'll be having a little look at the questions pane in a second. And again, please feel free to share your positive and constructive feedback. It's always welcomed, and it's always going to help us to enhance and improve the sessions as we move forward. So thanks again, everybody, for your time. I'll hang on now for a few questions, and you're able to contact me as a follow-up if you have any kind of, more detailed things you wanted to go through.